Good morning, everyone. We'll do like Elijah Cummings. You can do better than that. Good morning, everyone. Good morning. Okay. I'm joined by our Health Commissioner, Dr. Sharasa, to talk about International Overdose Awareness Day. 2019 marks Baltimore City's 5th observation of International Overdose Awareness Day. This event, held on August 31st, shed light on substance abuse, use disorder, and reduce stigma, while bringing hope and support to the families of those suffering from addiction. Baltimore City lost 888 residents to overdose in 2018, including 758 to fentanyl-related overdose. Fentanyl is a deadly synthetic opioid many times more powerful than heroin. The Baltimore City Health Department used a 3-pillar strategy to combat the opioid epidemic. Dr. Zarasa will share more about this, how this strategy has been deployed in the city. The Health Department also works with the Fire Department, Behavioral Health System Baltimore, state agencies, and other public health partners throughout the city to address substance misuse. Overdose Awareness Day is a time when we need to recognize that the disease of addiction kills, and the stigma attached to the disease prevent people from getting the help that they need. People suffering from a substance abuse disorder should not be afraid of seeking treatment because of what other people might say or think. The hesitation costs us lives. The Health Commissioner is joining me today because it's important that our residents hear from us and know that they are not alone and that their elected leaders are working hard to fight this epidemic. With that, I will introduce Dr. Sarasa, Health Commissioner for Baltimore City.
Thank you, Mayor Young. As Mayor Young stated, this year marks the Baltimore City's 5th observation of International Overdose Awareness Day. This annual event, held on August 31st, really does prove to shed light on substance use disorder and reduce stigma while bringing hope and support to the families of those suffering from addiction. Unfortunately, the opioid epidemic continues to drive overdose rates across the city, state, and region. As Mayor Young mentioned, last year Baltimore City saw the loss of 888 lives linked to overdoses. And the lacing of opioids with fentanyl remains the major factor in this surge of overdose deaths. Last year, roughly 85% of fatal overdoses were fentanyl related. While we have seen a drop in death rates this first quarter of 2019 statewide, we remain very heavily engaged in our 3-pillar strategy. This 3-pillar strategy focuses on 3 things: reversing overdoses with naloxone, increasing access to ongoing or on-demand and evidence-based treatment, and fighting stigma with education. We work with multiple partners such as EMS, police, hospitals, and clinics to train residents on how to spot an overdose and how to provide naloxone to people in need. Using naloxone to reverse an overdose can help save a life, and we are constantly working to expand access and availability of this antidote. Working with our partners, we have also implemented a 24/7 crisis information and referral line to help connect people in need to services and treatment. In conjunction with the Maryland Department of Health, Behavioral Health System Baltimore, hospitals, and clinics throughout the city, we have introduced a series of initiatives designed to increase access to treatment. Working closely with many of the aforementioned partners, we have opened Maryland's first Crisis Stabilization Center, located at Turk House in West Baltimore. The Crisis Stabilization Center serves as a way to connect people with opioid use disorder directly to services and treatment. We work with hospitals to introduce the Levels of Care initiative, ensuring that hospitals across the city are implementing national best practices to help patients with substance use disorders. We continue to work on expansion of the hub and spokes model initially pioneered in Vermont to expand access to medication-assisted treatment through providers in the city. The Law Enforcement Assisted Diversion Program, operated in partnership with Behavioral Health System Baltimore and the Police Department, help link residents with substance use to case managers and treatment instead of funneling them through the criminal justice system and subsequently away from the help that they need. The EMS Leave Behind program brings naloxone kits to people who administer naloxone along with people who have overdosed to help ensure kits remain nearby. The Behavioral Health Leadership Institute mobile unit, housed just outside of the jail, acts as a low-threshold means to start patients on medication-assisted treatment. Our overdose fatality review team continues to meet, study, and make recommendations to combat the crisis based on trends observed in overdose data. We also continue to promote educational materials through our Don't Die campaign. Through events like International Overdose Awareness Day, we shine light on the chronic disease that is addiction, and we fight stigma through the language that we use. We know that providing wraparound services is critical to addressing the underlying causes of substance use disorder. People who suffer from addiction often also need assistance with transportation, housing, and utilities. We also know that trauma is often both a root cause and a consequence of substance use disorder. Therefore, we're providing trauma-informed trainings to health department staff and working with partners in the community and in our schools to address trauma. We also know that expanding access to high-quality medication-assisted treatment through the hub and spokes model is critical to ensuring residents have access to care when they seek help for substance use disorders. I want to thank Mayor Young for his dedication to fighting this epidemic and for the work he has done for years to make Baltimore City residents, to make sure Baltimore City residents have a staunch advocate in City Hall when it comes to addiction. I also want to thank our partners, including the Fire Department, the Mayor's Office of Emergency Management, Behavioral Health System Baltimore, local hospitals, treatment providers, community organizations, and advocates for the work they do to continue to fight this epidemic. And I want to thank all of our residents for their resiliency and support as their family, friends, and neighbors continue to suffer from the deadly disease of addiction. Lastly, if you're experiencing substance use disorder or mental health disorder and want help, please call the 24/7 Mental Health and Substance Abuse Helpline at 410-433-5175. Again, that number is 410-433-5175. Thank you. I'll now turn it back over to Mayor Young.
Thank you, Dr. Zavassa. Any questions on International Overdose Awareness Day?
You said that 85% of opioid deaths or overdose deaths in Baltimore are related to fentanyl. Previous commissioner had said we weren't getting enough state funding for Narcan to really save all the people who needed saving. What more needs to be done in your view to really have an impact to drive these deaths, this death rate down?
Yeah, so I mentioned our focus on the hub and spokes model. So I think expansion to medication-assisted treatment, that's evidence-based for those people who are in need of treatment and seeking treatment actively. We have Maryland's first crisis stabilization center, which serves as a sobering center to provide support to residents who've experienced a non-fatal overdose. So residents are typically referred to that center from a local emergency department or from other providers in the community. And there they receive wraparound support services. So there are case managers there that can provide linkage to care. So far, the data that we've seen in the first 30 days is more than 50% of people who've come through that center actually remain linked to care. So I think it's about expansion of access to medication-assisted treatment and wraparound services.
So is that hub and spokes model fully implemented, or is that something currently being developed?
We currently have one hub in the city with about 11 spokes, and we actually serve as one of the spokes. So one of our mobile units does prescribe buprenorphine, which is the medication that is prescribed in that model.
The majority of methadone clinics are in the city of Baltimore, far and away. Is that going to continue to be the city's I don't want to call it policy, but the best way to treat addiction is through, folks going to a clinic in a community daily to get a dose of methadone, as opposed to, prescription that people may be able to use at home.
So I think there's lots of options for treatment. Medication-assisted treatment is one. Methadone is an example. Buprenorphine is another example. And buprenorphine is the medication that's used typically in the hub and spokes model. So certainly the advantage to buprenorphine is that it can be prescribed and that you don't necessarily have to come in daily. So we do want to really focus on how we can expand the prescription and the prescribing across the city of buprenorphine.
Thank you. Thank you.
Thank you.
Okay. Yeah.
Yeah.
Thank you so much. All right, any general questions?
Jack, Mayor, there was a...
Jack is fine.
$6.2 million was approved today by the board for disbursement to various agencies for, cyber attack remediation, as it's called. There has yet to be an accounting of the dollars spent for what it's been spent for, who's making the money, who's getting the money, how the contractors were selected. They were all selected on an emergency basis. At what point is that going to happen?
Well, is Frank here?
No, he's not here.
Frank is not here.
We have the itemized list on the website, so there is a list of who.
Right, but for what it, right, correct, yes. But none of those have come from the Board of
They
Ethics.
will.
Yeah, they haven't come yet. Frank and IT and Show Goldstein's been working very closely on that. So when we get that information, it will be made ready, available. You said it's on the website already? It's on the website.
This morning the DOE deferred.
I can't hear you.
This morning the DOE deferred an item to purchase cyber insurance for the city. Why was that decision made?
Well, everyone hasn't been briefed on that yet. I was briefed on yesterday. I think the comptroller and the president has to be briefed on that, and that's the only reason why it was pulled, because it's something that we really need. We have to have that insurance in case a breach like that happen again. Hopefully it won't happen again.
Why has the city not taken that step in the past?
I have the slightest idea why the city haven't taken that step in the past. City is self-insured, like everybody knows, but I thought that would have been an insurance that we would have had, but we didn't. But we're moving forward, we will have that protection.
You met last Friday with Governor Hogan and Police Commissioner, and after, I understand you distributed a letter with a bunch of asks about different things the governor could do to help the city with crime. Have you heard anything more about these things?
We're still, our staff is working with their staff, and I feel very confident that we're going to get the majority of the things that we asked for. The governor has to go back and really find the money, what he said he was going to do, and I'm trusting that we're going to get what we need.
Did the governor ask for your support for any of his legislative initiatives?
No, he did not. No, he did not. That did not come up. The only thing came up was what we went in there seeking, and that was the $7 million that we need for our upgrades to our police department, the training facility for our recruits, and those kind of things. So I feel very confident we're going to get what we asked for.
Did you talk about the surveillance plan at all?
No,
No.
never came up. No.
The crime suppression stops, what's sort of the plan behind that, the hope with that in the long run?
Well, crime is unacceptable on any level. So the police commissioner is working on his strategy, and with the help that we're seeking from the governor, I think we're going to be able to do some good things to drive down crime in the city of Baltimore. But like I said, I don't care what kind of technology you get. I don't care whether, people think we can do it by ourselves. The elected leaders, the police commissioner can't do it. We need community to step up and help us. They're the eyes on the ground. They see, they know who's doing, the crime. And we're just seeking everybody's help. And we're going to have help from our state partners, our federal partners. You heard the U.S. Attorney last week talk about their effort to work with the police department to drive down crime, going after the most violent criminals with the warrants. We have warrants out. We need to go and execute those warrants. And I guarantee you, when we execute those warrants, most of the people who are doing all of the criminal activities in the city in terms of murders and shootings will help that go down.
Mr. Mayor, earlier yesterday morning, a policeman was shot at after approaching a car. He wasn't struck, but so the police are still looking for him. The FOP has tweeted out that they're upset at how out of control things are in the city. Respond to that, sir?
Well, we're all upset, with crime being out of control in the city. And we need all our partners, including the FOP, to, sit down and figure out how we all can work together instead of everybody putting out all these little quotes. I mean, if we're serious about driving down crime, we need all the partners at the table. We don't need people tweeting and being a distraction. We need everybody, all hands on deck to work together. And I'm hoping that we can get that for people.
Do you have any conversations with the leadership of the General Order of Police?
No, I think we have a date certain set up to meet with them. Topic?
Yeah, what's the meeting about?
Well, they reached out, to have the meeting. So I guess we're going to talk about a number of things, I mean, I really don't know what they want to talk about, but I know I want to talk about how we can work together to improve the crime fighting in the city of Baltimore, because these are the members of FOP, and they need a direction from the FOP on how we're going to get this city under control.
What's the impact of their negative attacks on the Commissioner's crime plan, consent decree?
It's a great distraction, From what I understand with the consent decree, it has nothing to do with them fighting crime. I mean, the job is to protect and serve. And we have a lot of our officers in that blue uniform are out there doing just that. Some of them are out of their cars, engaging the community like we asked, some are not. And until we can get all of them to do that, you know, I don't think we're going to be able to make a dent in that police-community relation piece. See, I'm trying to get them to engage the community, to build that trust back up. Once you build the trust back up, we'll start getting information on who's committing all these crimes. And that's the number one thing that we're trying to do, is get that community police interaction back into the police department.
Anything else?
Thank you.
Thank you.
Thank you.